This video will discuss the topic of measles. We will look at what measles is, the history of measles, what are some signs and symptoms, how it may be transmitted, who is most at risk, how it may be treated or prevented, and lastly, what the MMR vaccine is. To start off, what is measles?
Measles is one of the world's most contagious viruses, and 90% of unvaccinated people who are exposed will get infected within 7 to 21 days. Death rates have been decreasing worldwide, but the disease still kills more than 100,000 people annually, mostly under the age of 5.
History of measles.
In 1912, measles became a highly notifiable disease in the United States. There was an average of 6,000 measles-related deaths annually. Before vaccines were available, mostly all children developed measles by the time they were 15 years old. By the year 2000, measles was declared as eliminated in the United States. This was due to the highly effective vaccination program. The vaccine was created by John Enders in 1963. He originally started his work a decade ago by collecting blood samples of children infected with measles. They isolated the virus in the students' blood and created the measles vaccine. What are some signs and symptoms? Measles usually begin in the respiratory system, with the first symptom being a fever. Other symptoms followed by the fever include cough, runny nose, red and watery eyes, and small white spots inside the cheeks called cowlicks. Subsequently, rashes will commonly appear on the face and neck, and to the rest of the body after the onset of the first symptoms. Symptoms appear as early as 3 days and may last up to 18 days. How can it be transmitted? Measles live in an infected person's upper respiratory tract and can transmit the virus 4 days before and after the rashes appear. An infected person can release the virus into the air when they cough or sneeze, and it can live in a contaminated environment for up to 2 hours. If a susceptible individual breathes the contaminated air or touches an infected surface and then touch their eyes, nose, or mouth, they can get infected as well.
Who is most at risk? Children who are unvaccinated due to being too young of age are at risk for developing measles. These children, as well as immunocompromised individuals, depend on herd immunity. Herd immunity is protection from a disease for children who are too young to get the MMR vaccine and ones that are immunocompromised. Also, unvaccinated pregnant women are at risk. Can it be treated? Although there is no treatment, non-immunized people, including infants, may be given the vaccine within 72 hours of exposure. These individuals will still develop the illness, but will have milder symptoms that last for a shorter period of time. How can it be prevented? The first dose of vaccine is called MMR as it protects against measles, mumps, and rubella, and it is given at 12 to 15 months of age. The second dose is given at 4 to 6. Most people who get the vaccine do not experience side effects, but if they do, the most common ones are fever and a mild rash.
What is the MMR vaccine? The MMR vaccine is very effective for protecting against measles. This vaccine contains small amounts of attenuated or inactive viruses which are not infectious. The immune system responds to the inactive viruses and develops immunity against them. Children who have received both doses of the vaccine are generally protected for life against this virus. Although the rare few individuals may still acquire measles due to the decreased immune system response. 3 out of every 100 children will get measles if vaccinated and are exposed to this virus. In addition, they will have milder symptoms and are less likely than others to pass on the virus.
So what really happened at Disneyland? Well, let us tell you in person. Thank you for watching.